Doctors have welcomed the scrapping of a deal that encouraged pharmacists to promote vitamins and supplements when filling prescriptions. Last month, the Pharmacy Guild unveiled a plan to endorse Blackmores products at checkouts when patients bought prescription medicines. But it's now withdrawn from the deal. The union, which represents 20,000 pharmacists, says it's pleased, and doctors are also relieved.
There's simply no place for Coke and fries in medication management. This is a win for consumers, it's a win for pharmacists, it's a win for the relationship between your family doctor and your local pharmacist.
The Pharmacy Guild says it was a mutual decision in light of strong public concern.
The Pharmacy Guild has grudgingly abandoned a controversial deal with the vitamin company Blackmores. The agreement would have meant pharmacists getting computer prompts suggesting they recommend specific Blackmores products alongside some prescription drugs. Doctors' groups attacked the arrangement and some pharmacists protested as well. Now, Blackmores and the Guild have scrapped it, but the Guild maintains there was nothing wrong with the plan. Instead, it's blaming inflammatory media reports. Stephen Jedgetts reports.
The deal provoked an immediate and furious response from patients and doctors, who argued it could compromise pharmacists' clinical decisions. Some chemists put up signs saying they would not be recommending Blackmores products. Now the Guild and Blackmores have read the writing on the wall and abandoned the agreement. The president of the Australian Medical Association, Dr. Steve Hambleton, says the decision is welcome.
The AMA thought the companion product deal was outrageous. This was a win for patients, a win for the pharmacy profession, and a win for the family doctor-pharmacist relationship. There's no place for commercial interference in this clinical decision-making of the pharmacist. This is exactly where this was going to go, and there's certainly no place for a Coke and fries approach to medication management.
The Pharmacy Guild has declined PM's request for an interview, but in a statement it says it's dropped the deal because inaccurate media reports created a furore that was damaging the profession. It maintains pharmacists would not have been forced to recommend Blackmores products, and there would have been no direct financial incentive for them to do so. But Dr. Hambleton says the computer prompts suggesting related Blackmores products would have crossed the line.
This prompt was going to come up at the time of the clinical dispensing by the pharmacist, and was going to leverage off that very close relationship the patients have with their pharmacist. The prompt comes up right at the point of dispensing, and that's the problem we had. It was right at that critical juncture. We've got to make sure that pharmacists are free to make independent clinical decisions.
The Greens Senator Richard Di Natale says the Pharmacy Guild seems to regard the whole episode as a PR blunder, when it's something much more serious.
I think what's really disappointing here is that the Guild have not acknowledged that they've made a mistake. Rather, what they've said is that they've bowed to public pressure. The relationship between pharmacists and patients is a really important one, and it should never be compromised by commercial dealings. The Guild have made a big mistake. They should acknowledge it, rather than implying that what they've done is a public relations mistake. No, this is a very serious professional error.
Stuart Baker runs a pharmacy in Mortlake in Western Victoria. He quit the Guild in protest when the Blackmores deal was announced. He says he won't be rejoining now, despite the backdown.
I think it's pleasing that the Guild has retracted from the previous position, but the damage has been done. I'm not sure how much this change will restore public confidence in community pharmacy. I hope it does. Those who are attuned to the needs of their patients aren't really happy with this sort of retail selling and upselling model. It's inappropriate, and a number of us have been uncomfortable about it for some time.
Health advocates have also raised questions about whether pharmaceutical companies exert too much influence over doctors. Many remain concerned the industry uses promotions to win favour with GPs in the hope that they'll prescribe their products. The AMA says there are now strict guidelines governing pharmaceutical industry promotions. But Dr. Hambleton says it's still important to be vigilant.
Look, I think all health professionals need to make sure that their relationship is with the patient and with the patient alone. We have to recognise that pharmaceutical companies do try and push their products very strongly, but we're talking about a very educated audience here. The primary outcome must be the welfare of the patient.
Senator Di Natale says the guidelines should be more restrictive.
There have been some positive moves in terms of the guidelines, but in our view they don't go far enough. We think that there are a range of areas where improvements could be made around disclosure, and it's very important that when people go and see a health professional, whether it be a doctor or a pharmacist, that in fact they can be confident that the advice they're giving hasn't been compromised by commercial factors, but is based on the best available clinical evidence.
Blackmores has also declined to be interviewed, but in a statement it says the deal was creating considerable confusion, which could detract from the underlying benefits of its products. It says it has enormous respect for pharmacists and it had no intention of compromising their ethics.
Stephen Jedgetts.